Hi everyone, we are the Doctors Bjorkman, a physician couple going week by week through pregnancy, sharing medical education topics from trying to conceive to pregnancy, labor and delivery, as well as postpartum, and sharing our own in real life experiences as we live it. This week I am 8 weeks pregnant, so we are talking all about going to that first prenatal visit.
That's right. With this week, we're going to be focusing in on that first visit, things that you can expect, and how to best be prepared to make the most out of that first meeting with your OB provider. And just in case this is your first time meeting us, I'm Kurt, I'm a pediatrician.
I'm Sarah, I'm an OBGYN.
And we are the Doctors Bjorkman.
Welcome back. Last week we covered nausea and vomiting of pregnancy, so hopefully what we covered was able to help you combat those all too common symptoms of the first trimester. If you missed it, go back and check out week 7 for tips and tricks on how to fight that first trimester morning sickness or all-day sickness.
And 2 weeks ago, in week 6, we talked a lot about how to choose where to give birth and also who to be your OB provider. And that discussion is going to be really helpful this week as we're talking about the first prenatal visit. And so hopefully from that time that conversation has helped you and you've already looked into scheduling that visit.
Definitely. So with that, this week we want to give you some insight on what to expect at your first prenatal visit. But before we do that, let's talk about what's happening with baby's development.
It's week 8. Baby's growing really fast now. It's looking a little bit more like a human and is already the size of a raspberry. While the arm buds and the leg buds have continued to grow, the hands and feet are now starting to differentiate. They look a little like paddles at this stage, but it won't be long and hopefully those fingers will be grabbing yours.
The first prenatal visit usually happens sometime between week 8 and week 10 of pregnancy. So once you've confirmed you're pregnant and chosen that OB provider, it's a good time to call and get that appointment scheduled because it may take some time to get in depending on the group or person that you're hoping to see.
Yeah. And this visit actually ends up being one of the longest visits you're going to have of your pregnancy.
Yeah.
But it's got 3 big goals. Okay? And those are first for the OB provider to learn all the important things about your medical history. Second, to make sure you're up to date with all of the OB care you need. And third, to help you prepare for the next 30 plus weeks of pregnancy. Our goal this week is to help you be prepared for this one visit to make it as useful as possible for both you and your provider.
Definitely. So in terms of your medical history, your provider is going to want to know everything. They're going to want to know any medical problems that you've had in the past or have now. They're going to want to know about any surgeries you've had. They're going to ask all about your GYN history as well as your OB history, and that includes any prior pregnancies, birth, losses, or terminations. And they're also going to talk to you about your mental health history. This can seem like a lot, but it's really important in terms of optimizing your health and your baby's health throughout your pregnancy. And so this helps your provider anticipate things that could come up during your pregnancy.
They're also going to want to know any medications or supplements you're taking. So it's good to write down a list of anything you're taking, how much, how often. The other big piece of information that's going to come up at this too is family history, both for you and your partner. And so this is extra important that you sit down with your partner before you go, given current visitor restrictions. So things that you can think about is there any family history of genetic defect, specific history of cardiac defect, or even any history of learning disabilities.
In addition to making sure they know all of your pertinent medical history, this first prenatal visit is a great time for your provider to make sure you are up to date with all of your needed medical care. To get this started, your provider or one of their nurses is going to take a baseline height and weight as well as your vitals. You're also going to have a complete physical exam. So they're going to listen to your heart and lungs, do a breast exam, as well as do a pelvic exam to assess the size of your uterus and the shape of your pelvis. They may also get a pap smear at this time if you need one.
They're also going to do a couple of tests, which are commonly blood and urine. The most common blood tests start out with getting a blood type with Rh factor, which becomes really important in pregnancy. Screening for immunity to certain diseases like rubella and chickenpox. And then also looking for STIs like hepatitis B, chlamydia, gonorrhea, syphilis, and HIV. These tests are standard for all pregnancies, and so even if you feel like they aren't pertinent to you, it is in the best interest of your developing baby to make sure that these aren't at play, as they can have pretty significant effects to the developing fetus, and it's best that if you have them, they get treated right away.
Definitely. So you're also going to give a urine sample, which is going to look for blood, protein, glucose, or bacteria. Just a heads up, you're going to give a urine sample at every prenatal visit because the two common complications of pregnancy, diabetes and preeclampsia, both have markers that begin to show up in the urine. The first prenatal visit is really long. My visit started with an hour-long visit with the nurse where she collected a lot of that history we talked about, my past medical history, medications, gyne history, OB history. We talked about my family history. We talked about Kurt's family history, which we had reviewed before I went because unfortunately he still can't come to most of these appointments. And then you talk to your doctor, and then you have to go to the lab to get your blood drawn, and then you maybe have an ultrasound. So it's just kind of a long ordeal, but it's the part of the process.
Another piece of testing that will be discussed at this first prenatal visit is genetic screening, and this is going to be discussed in two types. The first of which is carrier screening. Carrier screening looks at mom and dad for specific common conditions that you could be carrying without even knowing it. This is things like Tay-Sachs, cystic fibrosis, spinal muscular atrophy, or even blood conditions like sickle cell disease or thalassemia. Now you may have done this before even conceiving, but if you haven't, now is a time when you could still do that.
The second type of screening that will be discussed is first and second trimester genetic screening of your baby that is looking for aneuploidies and certain genetic conditions. Given that genetic testing is such a kind of complex topic, we are going to cover it in full detail in next week's episode, week 9.
The final part of this first prenatal visit is confirming gestational age and assigning an official due date. You may have already done this if you had an early confirmation of pregnancy visit, but if not, that'll happen this week.
So your OB provider is going to calculate your EDD, or your estimated date of delivery, also known as the due date, by going 40 weeks from the first day of your LMP, and then comparing that to the measurements from your very first ultrasound and making sure they line up.
So you may remember this ultrasound picture from Sarah's 6-week confirmation of pregnancy visit. At that time, they did what's called a crown rump length, or measuring from baby's head to tail. It's this length in combination with the last menstrual period date that helps your OB provider estimate your date of delivery.
This is the first visit for you to get to know your provider and your provider to get to know you. So I really encourage you to write down a list of questions that you have ahead of time, because I know when I get into the room with the provider, I forget everything I wanted to ask, and I get home and anyway.
Yeah, so some things you might want to have on your list include things like, when should you call?
Is there a nurse line, or what's the best way to get in touch with your provider?
Yeah. When's your next visit going to be, and how many visits should you plan on for pregnancy?
What kind of changes are happening at the practice or at the hospital because of COVID?
Yeah, and this is also going to be a really good time for you to bring up any special desires you have, like unmedicated birth, vaginal birth after C-section, or even wondering how long past your due date might you go.
So that is the first prenatal visit. Hopefully that gives you an outline of what to expect. If you have any questions, please leave them below. We're happy to answer them. And otherwise, we will see you
next week. We're going to come back talking all about genetic screening and testing for baby. So anyway, click subscribe. We'll see you in a week. We're doctors.
But not your doctors.
Anything we've said in this video is for education or entertainment purposes only.
It is not medical advice.
Any specific medical questions you have should be directed to your provider.